All right, today we are going to break down a huge milestone for any emergency medicine trainee, the MRCEM Intermediate Single Best Answer Exam. We're going to get into what it is, how it's built, and, most importantly, how to prepare for it, not just to pass, but to pass it well.
So what's the big idea behind this exam? Well, this quote right here gets straight to the heart of it. If you think about the MRCEM Primary, that was all about what you know. This exam, the Intermediate, is all about what you can do with that knowledge. It's that massive leap from theory to practice. Can you apply the science, safely, systematically, to real people? So think of it less like a stuffy academic test and more like a simulation of your actual clinical thinking.
And that's exactly what it is. This exam is that critical bridge. It's designed to pull you out of the world of textbook facts and drop you smack dab in the middle of real-world clinical reasoning. It's literally built to mirror the kind of thinking you have to do every single day in a chaotic emergency department. And what's so cool is just how practical these skills are. The exam is basically asking you a series of really important questions. Can you look at an undifferentiated patient and figure out where to start? Can you prioritize which tests are urgent and which can wait? Can you kick off management that's both effective and, safe? And maybe the most important one, can you spot when a patient is getting sicker and recognize those red flags early on? This is it. This is the core checklist of a safe, competent ED doc. Now, the format itself is pretty straightforward. You're going to face 180 single best answer questions in 3 hours, and it's all computer-based. Now, if you do the math, that works out to exactly 1 minute per question, which means time management is a huge part of what's being tested here. There's no time to dawdle, but you've got to pace yourself. It's a marathon, not a sprint. Okay, let's talk logistics. Because before you can even dream about preparing, you've got to know if you're eligible, when the exam dates are, and what it's going to set you back. The eligibility criteria are crystal clear. You need a primary medical qualification. You absolutely have to have passed the MRCEM Primary. You need a current medical registration and at least 2 years of clinical experience. And here's a really key bit of info. That experience doesn't have to be in the UK or even all in emergency medicine, which is a big deal for a lot of international doctors out there. Okay, I need you to pay close attention here, because this is absolutely critical. Just look at those application windows for the 2026 diets. They are incredibly short. We're talking 7 days, just 1 week. This is not something you can just decide to do at the last minute. You need to get these dates in your calendar right now and be ready to hit that submit button the second application's open. If you don't, you will miss your shot for that whole sitting. And then, there's the cost. The fees are going to vary a bit depending on where you are and if you're an RCEM member, but you can expect it to be somewhere in this range. And here's a little pro tip that could save you some cash. The official info makes it pretty clear that becoming a member of the Royal College of Emergency Medicine before you apply is almost always the cheaper way to go. Okay, let's get into what is, without a doubt, the most important part of this whole explainer. If you want to pass this exam, you have to understand how it's built. This isn't about just randomly reading textbooks. It's about strategically understanding the exam's blueprint, which is all based on these things called Specialty Learning Outcomes, or SLOs. And this is the point right here. The exam is not random. It is meticulously blueprinted. The questions are not just pulled out of a hat. They are designed very carefully to test specific areas in specific amounts. And what that means is your preparation can't be random either. It has to be targeted, deliberate, and perfectly lined up with the exam structure. And this chart, this is your study guide. This is your treasure map. It shows you that structure perfectly. Just look where the marks are. A full third of the exam, 33%, comes from SLO1, the complex stable patient. Then you've got SLO3, resuscitation, at 22%, and SLO4, the injured patient, at 17%. Just those 3 SLOs make up over 70% of your entire score. So if you spend equal time studying everything, you're doing it wrong. You have to focus your energy where the exam focuses its questions.
So let's break down that biggest chunk, SLO1. This is the absolute bread and butter of the ED. We're talking about those stable but complex patients you see all the time. Think about your cardiology, respiratory, and endocrine emergencies. The thinking they're testing here is all about your differential diagnosis, risk stratification, and making those safe disposition calls. Can you work through a tricky case and actually land on the right plan?
Next up, SLO3. This is where physiology meets immediate, decisive action. This is all about resuscitation. It covers the sickest of the sick patients in the department: sepsis, shock, anaphylaxis, cardiac arrest. The questions in this section are really only testing one thing: What is the single most important thing you have to do right now to save this person's life? It's pure physiology under a ton of pressure. And then there's SLO4, which covers the injured patient. Now, the key insight here is that the exam rewards a systematic, structured approach. Think ATLS, primary survey, secondary survey. This is not about some obscure orthopedic classification you read once. It's about whether you can apply a framework to safely stabilize a patient with major head, chest, or abdominal injuries in those first critical minutes. So we get the blueprint. We see how it's built. How do we actually translate that knowledge into a winning preparation strategy? Because this isn't just about working hard, it's about working smart. Well, the candidates who do well tend to follow 5 key steps. First, study by SLO, not by textbook chapter. This guarantees you're spending your precious time on the highest dealed topics. Second, align your learning with official RCM and NICE guidance. Why? Because that's where the people writing the questions get their answers from. Simple. Third, practice a huge volume of SBAs. I'm talking thousands. This isn't just for knowledge, it's to build pattern recognition for how they phrase the questions. Fourth, and this one is a game changer. Analyze every single answer you get wrong. Don't just look up the right one. Ask yourself why you picked the wrong one. That's how you fix the little cracks in your clinical reasoning. And finally, step 5. You have to sit full 180-question timed mocks. It's the only way to build the mental stamina and nail down the time management you'll need on the actual day.
And just a quick word on the rules and what comes next. You get a maximum of 6 attempts at this, and passing it is the critical gateway to that final hurdle, the MRCEM OSCE. You pass that, and you achieve full membership of the Royal College of Emergency Medicine, which is a massive milestone in any emergency physician's career.
So, after all of this detail, the blueprint, the logistics, the strategy, what is the one fundamental question this exam is really trying to answer about you as a doctor? This is it. Everything. It all boils down to this one simple question. Every single one of those 180 SBAs, in its own little way, is asking, can this doctor think safely in the emergency department? Passing this exam is the Royal College's way of officially saying, yes, they can.
So the final takeaway is this. The exam is tough, for sure, but it is not a mystery. Respect the blueprint, respect the SLOs, prepare deliberately. That is how you put yourself in the absolute best position to succeed. That's how candidates pass.